Yeah.
Good morning. I'd like to call the Door County Board of Supervisors to order on Tuesday, October 27th at 9 a.m. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Roll call, please. Ken? 21 present. Thank you. Presentation of the agenda.
Second.
All in favor?
Aye.
Correspondence. What's in your packet and some fund balance, some of the letters. We'll also receive 3 more letters. One from Michaela Kiffer, expressing report for the resolution racism and public health crisis. One from Martin Meyer, also supporting resolution 2020-86. And Kathy Braswell, Fish Creek, and Catherine English also supporting, Kathy Braswell supporting the resolution, racism is a public crisis, and Catherine English referring to the dairy on the building on Washington Island. Also Robert Seegers concerning the update on the mill pond that is contained in Ken's administrative update. Public comment. Is there anybody in the audience who should make a public comment this morning?
Okay, so what we will do is I will defer first to the Peninsula Room for individuals in the public that would like to speak. So in the Peninsula Room, if you could state your name and address and then your statement, you have the floor.
Good morning, County Supervisors. My name is Mike Mangan. I have a company called Irish Industries, Inc. My address is 185 East Walnut Street, Sturgeon Bay, Wisconsin. And I'm here as a courtesy to introduce my technology that I have recently, and not so recently, designed. I now have a space in your incubator, and I'm here to show some of the horse and dog and pony show of what I have designed. This first item is a solar-powered roof vent, which I basically designed 20 years ago. I have not patented it because I didn't have the funds or the expertise to patent it, but I would like to manufacture this in Door County in the incubator facility. My portfolio includes having built the first electric Harley Davidson in the state of Wisconsin. And if any of you are internet interest, you can Google Sparkster motorcycle, all one word, .com. I built this in 2009, 4 years before Harley Davidson, and took it to the Harley Fest and expected perhaps Harley Davidson would find some interest, but they haven't. So I'm here just to tell you that I am excited to be in Door County. I have an extensive background, 55 years in the energy field. My father had rental properties, and I read my first electric meter at the age of 6. And 45 years in renewables. I saw the first wind farm in the world in the Altamont Pass in 1977 as an 18-year-old going out to California to realize my dream. So I have been the first solar PV installer for state parks 20 years ago. And I also was the first one to conduct wind studies in Wisconsin regarding wind. So I have a multiple number of businesses that I'm hoping to bring to Door County in the incubator, and I look forward to being very productive and creating several environmentally friendly jobs, businesses in your county, and just wanted to say hi.
Thank you. Okay, I will now then go to individuals who will be online. Again, if you're online through a computer, you can actually, on the system itself, you can raise your hand and I can recognize you. For those that are call-in users, you can hit *3, and that'll also raise your hand and I can recognize you. And again, if you could state your name and address, and you have 3 minutes when I give you the floor. So the first individual It'll be Christine Reed. I will unmute you. You have the floor.
My name is Christine Reed. I live on Forestville Flowage. I'm with Friends of the Forestville Dam. I'd like to correct the record from last month. During supervisor response, Dave Enagel pointed out that he had talked to some sensible residents that were experiencing a drawdown similar to the drawdown at Forestville Flowage. I called the president of the Lake Association and we discussed the two drawdowns, and his assessment, not mine, is that the two drawdowns are not similar. I could go into many reasons why, but it would take more than my 3 minutes that are allotted. So just to correct the record, the drawdown between the McChickeny Flowage and the drawdown at Forestville Flowage are not similar for many, many reasons. Moving to the memorandum, County Administrator, Operational Projects, Mill Pond Project status, no significant updates to provide. We do have significant updates to provide. Friday, after 3.2 inches of rain, the flowage overflowed the dam for the 9th time, and it is still overflowing this morning. Less, it has dropped, but it is still overflowing. On Friday, it had increased to 7.5 inches of water flowing over the top of the dam, which is more than double the amount that was going over the top of the dam on November 1st when the drawdown started. The other significant thing to report is the amount of sediment that has been flushed out of the Forestville Flowage into the Anape River. Again, this is not my opinion. This is well documented. The salmon run started the first or second week of September. When we go to the dam to do our daily monitoring, we've been talking to the fishermen, and all of them, every one of them that we talked to, commented on the amount of sediment that has spoiled the river downstream. So it is being measured, and it's a mistake, and it shouldn't have happened. And that's it. That's all I've got today.
Thank you. Is there anyone else who'd like to speak? I'll say a second time, is there anyone else who would like to speak? For a final time, anyone else who would like to speak? That is it.
Okay. Is there any supervisor's response? Susan?
Actually, I don't know if this is exactly appropriate at this point, but and it's not really a response. I hope this is okay. I just wanted to point out, I've been listening to some of the committee meetings, and it's really important, I guess, and I need to do this as well, that we speak into our microphones, because as I listen to them, sometimes online and sometimes through my phone, some people come across crystal clear and other people are very garbled and you can't hear what they're saying. So I can only surmise that that's because some people are speaking into their microphones and others not. So just a thought that we need to all do that, especially at our committee meetings, not just today.
Okay, thank you. Anybody else? Approval of the minutes of the September 22nd, 2020 County Board meeting.
Motion to approve District 15.
Second, District 2. Is there any additions, corrections, grammatical remarks, public errors, omissions? None by voice vote. All in favor?
Aye.
Opposed? Before we move to County Administrator report, we are going to drop down to special reports. First one will be future public safety communication needs. Morning, Len.
Good morning.
Sure. So just for an introduction, before us today is Len Keenan. He's been working up for many years. All I did was create a hominy system even before I started. But we asked him to do a presentation. He's been working with our CAS committee, and we are looking at some significant upgrades to our system. And we thought it's at least a good opportunity to have him come in and kind of give us that, I guess, what we're facing in the future. So with that, maybe Len, you can introduce yourself a little more.
Very good, thank you. I'm going to pull my mask down because my glasses fog up and I can't see very well. Yeah, my name is Leonard Keenan. I'm from St. Paul, Minnesota, and I've had the pleasure and honor to work with your county since 1995. And we've come a long way and built a lot of nice things. We have a beautiful communications system today because of that. I'd like to point out some things in the cover slide there that's important for the future. And that's the picture on the left. Picture on the left is something you don't see very often, and that's a marriage of the radio communications world and the IS world. I have many colleagues and clients out there that they wouldn't let the IT people come within 100 miles of their radio equipment. But that's the future. The two working together. The silver racks on the left are your radio. The black racks on the right are your IT system. And they interconnect and use the radio system uses the IT's fiber optic cables out to the radio site. And so from your standpoint, it was a great investment, that marriage together. The two disciplines are very different, and what makes them different is the right picture, and that's these radio towers. And right now you have 11 radio sites to provide service throughout the county. This is your tower at Mill Road by the gravel quarry. The difference between IT or IS and a radio system is a term called real time. On your computer, you can tolerate the spinning wheel or the hourglass. In the radio world, you cannot. Everything has to leave the 911 center to the nearest thousandth of a second and arrive all the way up at Washington Island within a thousandth of a second compared to that, the Southwest Tower down in Union Township. Investments you've made, like I said, I started working for your county in 95 when we replaced the old plumb bottom tower and built the Sunny Slope Tower and upgraded the 911 center on the roof over where the old jail area was. Other investments you've made in 2004 was the new 911 center and Justice Tower. This was part of your Justice building complex. 2007, we did an upgrade with FEMA Aid to Firefighters grant from the federal government. We did a system upgrade. 2013, we did a full system upgrade, again with a FEMA Aid to Firefighters grant. And that was a mandatory upgrade by the Federal Communications Commission, and I'll get into that later. Outside of my purview, but a very good move, was the connection of all the radio sites with your fiber optic cable. That indeed was a wonderful investment. In 2017, we upgraded the 911 center electronics to the latest and greatest 911, or at least position yourself for other things that are coming in the future in 911. The thing I want to talk about today is in 2028, the upgrades, the full upgrade that you did in 2013 will be 15 years old. Next slide. There's a term in this industry called public safety life, and this is equipment that somebody's life, safety of life and property is dependent on. The most important term up there, and I won't get into the minutia of the small print there, you can see it on your computers. The most important thing is the fixed plant of the radio system, of which you have about 15 locations, has a life of about 15 years. Now, what causes that end of life is the manufacturer generally quits supporting the product. Software runs out, they won't upgrade software anymore. But the other thing, it's been sitting and operating for for 24/7, 365 continuously for 15 years. That's about 130, 140,000 hours of continuous use. And at that point in time, the public safety industry has pretty much determined that that's end of life. That doesn't mean you throw it away. It just means you move it into a lesser priority role. The other items down below are different time periods, computer monitors, chairs in a 911 center. They all have different lives. When I started in this industry in '68 in Minnesota with the Highway Patrol, elected officials had what was called the golden year. They would come to the sheriff or the chief of the patrol and say, okay, this year we're going to give you what you need to upgrade your system, but don't come back for 10 more years because next year Road and Bridge is going to get the money, after that Human Services and so on. It's this factor right here, these little terms here, that you can't really do that anymore because you've got all kinds of devices that make up a system that expire, their lives end at different times. And so you're continually having to have money in the budget for different pieces of the system. But at the 15-year point, pretty much the system is used up. The FCC is making changes continually going around. They're trying to make better use of the spectrum. And their way of doing it is one of two ways: cut the pie, the slices of the pie smaller, or forcing you to go digital and getting more uses out of that slice of the pie you have. And so in the mid-1990s, they published their first round of harvesting the spectrum. And the thing you saw the most was in HD television in 2009, when everybody had to buy new TV sets or buy converter boxes. And at that point, one TV channel broadcasted one picture. Today, one TV channel could broadcast up to 6 pictures. That's where the FCC is going everywhere. You also see it in HD radio, FM radio. If you have a special radio in your home or your car, one FM channel in the past would carry one soundtrack. Today it can carry up to 4 soundtracks. Same thing is coming your way. In fact, the first part of it happened in 2014. Next slide, please. In 2014, the commission ordered all public safety and the VHF band nationwide to split their channels at half and give half of your channel to somebody else. So if you think of a radio channel like a 2-lane highway here, but they said at January 1st of 2014, you have to get rid of this lane, put it into the pool, and maybe somebody in Wapaka or Oconto or up in Forest County would be able to use it to expand their system. On the other hand, a channel they give up in Forest County would become available to us. So that's what's going on. Cut the pie, slices the pie into a small piece. 2016, they went a step further, and they said all new equipment that's made has to not only work on that half channel you have left, but has to be able to work on a quarter channel. So they're intending to slice the pie one more time. So now think about our one lane that's left. We slice it one more time, and that gives you basically the shoulder of the road to operate on. But they had a caveat in it. They said you can keep what you had in 2014 if you put 2 conversations on that channel at the same time. Again, it's just like HD television, where now you have 6 pictures on one channel instead of 1, or FM radio, where you have 4 soundtracks on a channel instead of 1. They're saying you got to have 2 instead of 1. There are other, next slide, please. There are other issues that are affecting you in 2028. The VHF band that you operate on today is suffering due to electrical noise. It's a worldwide problem caused by these devices, the little power supplies with the module on the end that plugs into your computer or plugs into your, charges your iPhone or your audio devices, radiate terrible amount of noise, and they degrade the radio system. So what's the bottom line? reinvestment in the system you have today in 2028 probably won't be wise. This is not going to get better for a while. The governments worldwide are trying to get a handle on the technology that's causing the problem and forcing a change, but then all the jugs has got to come out of the marketplace before it gets better. So what's the plan of action? Fortunately, this isn't urgent for all of us. You've got a beautiful system. You've got 8 more years before end of public safety life. So my recommendation to you is to start saving CIP monies now. Little things like one new radio site called a greenfield site. In other words, that's a site that's totally wild today. It's about $1 million to develop. Updating one of your existing sites to another piece of the spectrum, about $600,000. And your fiber and your microwave and your towers are all still usable. But you're dealing in significant amounts of money coming, possibly coming your way in 2028. So for now, buy smart. Most of the equipment purchased from now on will have a life beyond 2028. And the bottom line is, you don't want to buy something and then have it thrown in the trash in 2028. You want to buy smart for the future. Next slide, please. The other thing is governance I want you to think about. Radio systems are going to become more like a government utility. They're no longer boxes that are bought out of separate budgets. When I started in this business, you could go into a radio hut and you could see what was bought out of the road and bridge account, what was bought out of the law enforcement account. Sometimes they were different brands serviced by different companies, all operating independently from one another. That will not be the case in 2028. It will become a quasi-government utility. Everything will be time-shared, just like your IT system is today. It functions like an IT system, but it must be isolated from your IT system. Remember the difference between real time and the tolerance for the spinning wheel or the hourglass. One cannot tolerate the other, but there is room for partnership and collaboration between the two disciplines. Must be managed like a shared utility. And it's more users on the system, the better. It's better to have everybody join the system than have what's called stovepipe systems out there of individual departments. You're going to be spending a lot of money on a fixed plant system. The more people use it, the cheaper it becomes for you. And so you want to avoid stovepipe systems. Next slide. So what will the 2028 system, your next radio system, look like? It'll be all digital. Meeting this national standard, 2 conversations on 1 channel at the same time, functions more like an IS network, IT network. It functions more like a government utility. Another thing is, once you can build a system where you can plug one into another, you can have intergovernmental collaboration. And you can collaborate with a state or a neighbor. And that's something to watch and happen. Right now, the state of Wisconsin has a statewide digital system. It's near end of life. It has a public safety birthday on it. It's near 15 years old. They're trying to replace it. Again, it's built to the standard. They hope in 2024, 2025 to have their system upgraded. And you could join their system. You can add to their system, or you can not join their system. That's something to look at in 2028, intergovernmental collaboration. One thing, the way the state of Wisconsin built their system is they built it for their needs. They have 3 sites to cover Door County. You have 11. So that means you're going to have to probably pay money to add to their system. I did the project in Kewaunee County. The state of Wisconsin bought 1 site. Kewaunee bought 3 more. So that's what we're talking about. When you collaborate with the state of Wisconsin, that means you have to add to their system. But at least you don't have to pay for that first site. or in this case, in Door County site, case 3 sites. You also can collaborate with Brown County. They have a ACO 25 system, although they're not contiguous with your county, and their system provides little service into Door County. So probably not something at this time that you'd want to do. Next slide. You have another thing that's happening out there we need to watch, and that's FirstNet. FirstNet is a quasi-governmental entity that's funded by the U.S. government from the sale of the TV channels 55 through 70. When the FCC auctioned them off, they took some of the money and they plugged it into a government corporation called FirstNet. AT&T won the project to build FirstNet out, and they've built a couple sites already in Door County. FirstNet is a combination between a two-way radio and a smartphone. And you can see the pictures of them in the upper corner. In some parts of the country, the service from FirstNet is so great, there are communities that are saying, I'm getting out of having our own radio business, a radio system. We are going to jump on the FirstNet, and our radio expenses will be a monthly bill to AT&T, or monthly check to AT&T. That's not going to happen everywhere. FirstNet will provide a lot of service to your county in the future, but it probably won't provide all your service. Next slide. So what will your 2028 system consist of? Well, right now, the far right slide here is probably what you have today. 90% of your communications needs are funded out of your levy. And you're getting some benefit now out of FirstNet, and you're getting some benefit out of intergovernmental collaboration. You're also, by the way, getting some benefit out of private industry collaboration. You have a nice arrangement with Cellcom, the cell provider, where you are providing in-kind services back and forth to each other for the use of their towers. But by and large, in your case, this is what you have today. You funded 90%, although some federal grants. But what could be coming? And again, we want to watch out for what is the future going to become. It could be you fund 1/3 of your system and depend upon FirstNet and intergovernmental collaboration for each 1/3, or you'll do 1/4 and the other two will provide the other 3/4. It is too soon to tell what it will be. Next slide. So what's the bottom line here? Key conclusions. Begin saving monies. I give you the costs of what things are. Purchase smartly. Equipment you'll be buying will have a life beyond 2028. You don't want to throw it away. You don't want to have to sell it for 10 cents on the dollar. Governance. The next radio system will be a shared utility, usable across management boundaries. And be aware of what the federal, the state, FirstNet, and the industry are doing. So give you some future there. Pictures here on the side. The left is a collaboration between you and Cellcom. That's the Fish Creek Tower. The center picture is your 911 center. And the far right picture are the towers on Brussels Hill. Your tower is the one on the left. The one in the middle was your tower, and the one on the far right is the state of Wisconsin's tower. So are there any questions for me?
Leonard, could you just give context too? We went digital. I mean, you gave figures like $1 million a site, but we need a projection for CAT, what the total investment we're looking at in 2028. Could you give us that context as far as how we have to densify the network if we go digital and what that potential?
Oh, I would expect it. You're probably looking at $7 to $10 million range at that point. And again, if you collaborate, if the state of Wisconsin comes in and builds 3 of the sites, and you decide to build the balance, and again, through the wonders of information services, plug the networks together, then they may build 1/3, you may build 2/3. And again, who knows though what the state of Wisconsin is going to do? They're out 5 years with their plans. The beauty of this is we've got time to plan. You've got a wonderful system working well. There's no emergencies. So be prepared.
Any questions?
Any questions?
Alexis?
Thank you, Mr. Chair. I just had a question when you referred to the government utility and the governance of a shared governmental management. You're just talking in-house with the county operations. This would not be something that we would offer public access or private access to, or maybe.
Well, first of all, you would really ask two questions, and I'll answer two of them. The first one, private entities will not be allowed by federal law. However, you could take in all the communication services, let's say from the city of Sister Bay or the city of Sturgeon Bay, in other words, their utility department. You could take it school district system. And that's where the governance comes in, because it's crossing the lines of your authority. Unless you want to be the funder of it all and say Merry Christmas to the users. But normally the way in people in other parts of the country that are down the road further on this, they have a governance committee where the users have representation on that committee, and that committee sets the levy for the system, which probably goes back to the individual members, and they put money into the budget.
Thank you.
David?
First, I'd like to thank you for your many years of service to Door County and many other municipalities across the country. We seem to live in a society right now that the experts are not worth listening to. I've listened to you for many years and value your knowledge and capabilities in that world and respect it. We seem to have a problem in our federal and state government right now in recognizing that. That being said, I know that you're working on a study, I don't know how far along it is, that involves Kewaunee County that could impact this decision-making process. Can you give us a brief description of what you are doing for that? I know Door County contracted you to do the study.
Yes, the project was joint dispatch, joint IT or IS collaboration. And about in the middle of the project, the joint dispatch just politically became unattainable. That's my opinion. I'll let the administrator give his. And the project was stopped and then refocused strictly on the collaboration of information services connections. And I restarted the project in August. I'm very close to being complete. I've got a few more pieces. And we are fortunate that the fiber optic cable that you own a portion of by Ensight, which is part of Cellcom, also has a presence in Kewaunee, right across the street from Kewaunee's fiber optic cable. And we're able to bore under Juno Street in Kewaunee and connect the two fibers together. And so you could have gigabit, 10 gigabit of data flowing back and forth between your information services frame and their frame, if you want to pursue that in that direction. The next step beyond that would be to have a completely dark fiber. And a dark fiber means you have full control of everything on that fiber.
And that is which at this moment, as a reminder, we have a 25-year lease on 3 strands of dark fiber.
That's correct.
The Ensight system.
That's correct. You do. The issue is the connectivity of your leg of the fiber and Kewaunee's leg of the fiber is in Green Bay, and you end up with so many connections and splices along the way that it's not as easy just to fuse them together, and it's basically having too long a garden hose and not enough pressure. So something would have to be done, and I'm working on that part of the project now, if there's a desire to have a completely dark fiber connection between the two. But right now, it looks like we can push a lot of data between two centers for not a lot of investment.
And is the intent of this collaboration what was the intent of the collaboration as far as the data center goes? I'm somewhat familiar with our system. Why are we making this? What are you designing the intent around?
From my standpoint, I'm looking at just the transmission, the carrier method. I'm building the highway. You guys decide what you want to run on the highway. But you're starting to see around the country where many counties are collaborating on county functions. Like in western Minnesota, we have counties that have given up their road and bridge departments and contracted with the neighboring county to do their road and bridge work. You're starting to see collaboration between human services departments where one county provides two other counties human services. And so that's where the world is going. There are political hurdles and technological hurdles to get there.
I guess so that can the administrator kind of give us a little bit of an idea as to what we're traveling down that road for?
So again, when we looked at the work, we have just a number of opportunities when we looked at this part of the study, just to look at the interconnectivity part is the IT side. For example, both counties are running TCM through human services. Both counties, if you had a true fiber connection, depending on the bandwidth, we could look at shared phone systems. We could look at redundant backups. We could look at sharing servers as far as capacity and certain other types of software, whether it be financial, that type of thing. So it's just looking at opportunities. The biggest thing that, if you talk with Jason, I think he's in the other room, but if you look at where we're going in terms of expenses, obviously a lot of it's getting more and more expensive. If you look at our budget, there's expenses in hardware, but if you look at our software costs, those are where we're getting hit hard in terms of yearly subscriptions and that type of thing. So if there are ways for us to look at this in the future to optimize some of those expenses, it's worth looking into. And I guess right now we're just, with this study, it gives us an opportunity to see what is the possibility of having that type of connection, what's the cost, and then should we look at in the future any types of benefits of making that type of connection, how would we get the ROI to make that investment worthwhile?
So at some point in time, this will come before the full county board for a much better detailed explanation of the differences between the counties and needs and services.
Correct.
One other thing I have to say, and this is more, I hate to use this term, but a shout out to Chris Heck and the individuals. A lot of the infrastructure we have today came via a grant that he worked very hard through multiple years to acquire to get the system that we have sitting up and running today in our radio system. Thank you.
Nissa?
Nissa, you need to unmute yourself. So we're not getting your sound. I'm not sure if you're unmuted on our end, but maybe if you just want to send your message in the chat, I can read it out for you. While she's maybe typing it, just one thing just for context for us in terms of having lenses, I just wanted to have a presentation to kind of give you an idea of what we're facing. 2028, again, is not that far off in some ways. But again, we're looking at anywhere from, initially we thought anywhere from that 7 to at one time even 18 million, depending on which way we go in terms of investment. And again, it's one of those things where we can start to set money aside each year, but when you're looking at that big of a project cost, you are probably looking at some form of bonding. So there's two ways we can kind of start looking at this. One would be putting some money aside each year, working towards that goal. Or the other thing would be is just knowing that we have to, at some point in time, plan to do a major bonding for this type of a project. But I just wanted to get it on the forefront when we started to look at our future, that this is one of those major expenses that we will not be able to avoid in terms of it, because when it comes as far as a transition, we have to do it. It's not an option for us. I haven't got anything from you as far as questions or anything, okay?
Bob?
Thank you, Mr. Chairman. Just curious, are we talking just 911 and radios for police and fire, or maybe the highway department? Like what does this all encompass and what does it not encompass? Like I'm assuming this is not cell service for the average person, or what we're talking all this investment in infrastructure. What exactly is it covering for us as a county?
First of all, it doesn't cover the average person nor commercial businesses spectrum that you use has a condition on it that it's reserved for public governmental use only. Regarding when you start building a system like this where you have autonomy and yet the ability for shared cost, generally the Road and Bridge Department or Highway Department is encouraged to join in on it. Their system may be new and it may take a few years before they reach a point where they're ready to jump on. City utilities, city street departments, generally over time they come on it. Like for instance, in the county that I live in Minnesota, the 911 is the primary user of it, all the functions of 911. But then the county highway department has since joined it when their radio system is expanded. And city public works departments have a presence on it. And but once you build the fixed plant, you can buy a radio and have autonomy, autonomous communications for the park department, where they think they have their own private system. And yet, through the wonders of digital technology, just like today, where each one of you is connected to a network on your computer, you can have autonomous service or you can have group service like you're having now. You can have the same exact thing with a radio system. And so there is an incentive to bring the highway department along. They don't have to replace the fixed plant to cover 11 locations in the county to get that level of service. You've already spent that money. Joe, go ahead.
But no, Len, thank you very much for this. This is something that I know was coming for a long time as well. And I think one thing that we all need to be mindful of going forward, and there is time to waste on this a little bit per se, but you know, with all the unknowns of the state and federal governments, I'm optimistic that there's going to be, like last time when Chris did the grant for 13, there's going to be grants and funds coming available from the federal government when the time comes here. Since they're the ones pushing it, I believe they're going to be the ones that are going to make funds available. But also, as far as Burke County is concerned and our unique demographics, we're going to have the opportunity to make one heck of a robust system greater than what we are now. And we're going to include anything and everything that's a public entity at the time. And one thing that you did mention is the public school system that we have, because as we all know, there's lots of money available for public education going forward as well. So that's going to be a resource that we'll be able to tap into collaboratively in the grand scheme of a robust system. And the fact that, like you mentioned with Cellcom and Insight, having that fiber backbone up and down the county, it's only going to get better as the years go by here. And once you have that fiber backbone, the sky's the limit on what we do here with anybody and everybody. So you put the county, everything we got, the highway departments, the public school system, and everybody on this fiber backbone, and Burke County becomes about, we're going to be sitting pretty good going forward when all this comes together. And it will happen. I mean, I'm more than optimistic and excited about what's going to be able to come available in the future here with our, communication. So it's a big deal, man. This is huge.
David?
I did remember a question because of Joel's comments. Correct me if I'm wrong. My memory is a few years back, the federal government and the state of Wisconsin reduced restrictions on government entities basically having more utilities. Much like Sturgeon Bay Utilities is owned by the city of Sturgeon Bay for their sewer, water, and electric power requirements. Internet is what I'm referring to. If I remember correctly, the federal government about 6 years ago decided it was perfectly acceptable for a municipal entity to have a utility providing internet services. What I'm curious is, knowing that and knowing that you operate throughout the country, have you participated in any effort by a municipal entity to provide wireless broadband? We have the tower system substantially, we just don't have the gear to do it.
The only one I'm familiar with, I did a project in Eau Claire, and they received a Department of Agricultural grant. And the way the grant was tailored, it was a partnership between a commercial entity and a governmental entity. And I think each one of them threw money and threw in kind in the pot. In the case of the county, they threw highway right away in. And in their service back is they got fiber drops into their radio sites for the system. And then the commercial entity got fiber, just probably very similar to your arrangement with Ensight, where they got a portion of the cable to exploit for commercial purposes. I don't know, and I'm still trying to find out if those Department of Agricultural grants are still available. It was intended between a rural electric co-op and a governmental entity partnering together. That's on my list to explore for my final report to you on the Kiwani fiber connection.
Okay, thank you.
Beyond that, I don't know, there's something similar to that in Texas. Texas has a law that it goes back to the Rural Water Act in Texas, where communities could band together and create a rural water authority. And Texas used that to create a 911 communications authority. They spun off that law, the state of Texas did. And so a county or a group of counties could band together and build a communication system together and would have the ability to assess a mill rate on the citizens and the property in their jurisdiction. And they had have requirements of how big and how many parties can be in that system. It can't be just one county. And a number of counties, this has got to be almost 20 years ago, took advantage of that in rural Texas to build a joint 911 and radio system and actually employ people to manage and operate that system all out of that mill levy.
Yeah, and the most I've heard is, and I know in Colorado there were several cities that have done a municipal-based broadband system. And that's one of our topics for the last few years here has been getting decent broadband of whatever style throughout the county. So thank you.
Laura.
Yeah, hi. Thanks. So to sum it up, as we choose this highway that we go down, right, and each county decides what exit they want to take, huh? And that's why this gets so complex because we can't predict the future. But all in all, for the county, you had suggested that we set aside CIP number. And after I heard our administrator reply that we're really 7 years out, right? It sounds like more of a bonding type of a project that we're going to do. But I was trying to suggest that CATS has or has not already, that they look at what they want to set aside. And if grants come more available. But I am definitely interested in these agreements that you have spoke about and how they look. I believe that for the study that's going forward right now, that gets concerned to different government entities. And if they have their own silo up and they're used to working that way, it's hard to open up the agreement. So if you could see either between you, what your knowledge is, and our administrator, those types of agreements, and educate on them or give examples of them, I think would really be beneficial because that helps lay the map out for those next 8 years. But to me right now, what sounds like 7 years and $10 million, I just see like we're going to probably be bonding this project and hopefully there'll be a lot of grant money coming up. But I'd be really interested to see what those agreements are and I get education of the samples of that. It might help us understand this whole system because it is so complex.
Yeah, and it varies all over. It varies with the entity's ability to pay. You have counties in Wisconsin that have gone to the state and said, well, jump on your system. We'll live with all its shortcomings for next to nothing. And you've got counties that are using the system and having very poor service because it was designed for the state patrol car. And they're trying to use their low power handhelds in bars and homes, and it doesn't work. You got that extreme, and then you've got the more sophisticated counties like yours that have had systems that work much better that said, well, we can do better on our own and we're not going to join you. And Brown may be an example of that. Manitowoc, Sheboygan have gone totally isolated, stovepipe away from the state for that purpose. So you're going to see a hybrid. The wild card in it is money, the pot of money. In the case of Minnesota, the state threw money at the situation and the counties just came running, If the state's going to give you money to do it, why bond it yourself? And you're seeing a lot of that. And what Minnesota did was bonded the whole system, and it's between 350 and 500 billion to build the statewide system in Minnesota. And then they're funding it out of the 911 charges on all telephone instruments. It's $1.25 or something like that. And that's paying the bonds back. And so it was almost foolish for an entity to say, I'm going to take a part in this. Even though there are shortcomings by joining it, it was built to such level that the shortcomings were much smaller than the Wisconsin system. And so you have, 99% participation in Minnesota, which you don't have in Wisconsin. And it just had to be was the pot of money thrown in. It made the decision easy.
We have time for one more question, then we need to wrap this one up. Joel?
I'll cancel my house. It's fine.
Okay. All right.
Thank you very much, Len.
Thanks for the information. Thank you.
Okay, let's go through your report. Okay. We'll take a break when we're done with Ken's report.
I'll keep my report under an hour this time.
Thank you.
Just in the report, I have just a monthly memo with all the updates. You'll notice that the memos got a little bit shorter. Again, as we're completing some of those projects, I'm just taking them off the list. So again, there's just updates on there. I will have an update later in the agenda on Washington Island for you. So, and we also added a new project for the housing for sexually violent persons, which we included in the memo. And right now, that's going back as far as the rescope of work to facilities and parks. The other part of that's the communications. This is an update on our CARES Act funding on page 9. It gives you an update of what we have submitted. And we actually do have that money or the check was actually put into the bank for our first submittal. We submitted on 9/15, $237,000 in terms of expenses related to, our response to COVID. We also have the remaining balance of the 234, which we already have or are planning to submit those items below in terms of reimbursements. So you'll see right now we're actually looking at a shortfall of about $43,000 in terms of our CARES Act funding, which again we anticipated. One thing of note, I know Dan is still here. The CARES Act funding was actually allocated to counties, but also local municipalities. So I know Dan is actually working with our local units of government to see if they're not using those funds to allocate them to Door County. So I don't know if we have any formal decisions yet, but we're also working on that. That would also put us in a good position in terms of our expenses. So as of right now, I think we're looking very well in terms of our response and also our reimbursements back to the CARES Act funding. Just wanted to provide a report on that. With that, I'll see if there's the only other thing that's on this in terms of my update is obviously I'll defer to both Dan and Sue in a second, but we have the pending, the state of emergency always on the agenda. And again, from our standpoint, we have the authority to make an emergency decision. David and I have not really done anything of an emergency as far as a decision. In fact, there's one item on the agenda that we just went through the normal process. But we still have the state of emergency or in effect, mainly because of all the reimbursements as far as our expenses related to COVID. And so our recommendation is obviously to still remain that or have that still on the books or still remain under that state of emergency. Simply for that, we can continue to request reimbursement through FEMA. So with that, if there's no other questions, I'll defer to Dan. Maybe you can give your update first, and then I'll see if I can give the floor to Sue.
Morning, everyone. Just take a few minutes just to briefly go over some statewide data for you and then what we're doing locally. The state of Wisconsin has, in the last couple of weeks, changed how they report their positive tests. They now break it up by positivity rate per person and positivity rate per test. The difference being that positivity rate per test was the one that was originally being given, or by person, I'm sorry. And what they found was people were getting tested multiple times because of poison. overall numbers. So they broke it out so you could see what individual test results were showing and actual individual people, what they were showing. So beginning of September, we were at 8.4% per person. Today, we sit at 24.5% per person for positivity rate. Beginning of September, for positivity rate per test, we were at 5.1%. Today, we sit at 12.8%. The state of Wisconsin Department of Health Services will tell you their goal is to be under 3% in that category to be considered under control. As far as recovered numbers statewide, we sit roughly around 155,000 recovered. That accumulates 78.6% of the total cases to date. Active cases in the state right now are at 40,538, which is about 20% of the total cases in the state. For reference, that is October 1st, we had 21,000 active cases. So hospitals continue to report statewide 84% bed use statewide, 87% ICU beds in use currently statewide. The Ultimate Care Facility site in Milwaukee currently, due to restrictions with initial rollout of guidelines and eligibility for patients to be taken there, had a slow start. As of yesterday, there were only 4 people administered to that site. They do hope to increase that as they have since relooked at those restrictions and ability to care for people down there. Door County does remain very high in its case indicator rate in terms of burden and trajectory, indicating a number of 780 per 100,000 people positive. Quick update on the testing sites. Wisconsin National Guard is working with my office and other partners, putting together weekly recurring testing in the county. It's going to be an alternating site between Sturgeon Bay Fire Department and Sister Bay Fire Department every other Monday. Those started last week on the 19th and will run through December 7th, 8 a.m. to 4 p.m. The National Guard has capacity to do 300 tests per day. I can report we did just north of 60 tests at our Sister Bay site last week and about exactly 200 tests yesterday at our Sturgeon Bay site from the National Guard. My office does continue to work with PPE needs in the county, working with all of our partners locally to make sure that they are not short on PPE. The county is positioned well for its PPE. As I can tell from as we sit today, the county does have is in decent shape with its PPE supply. Vaccination planning, again, we talked about flu clinics. Those, I'll let Sue kind of touch on that, but those went very well from my standpoint. Logistically, thought they were able to handle as much capacity as was needed. We learned a lot of lessons for eventual COVID vaccination planning, and all that will depend on when the vaccine becomes available and which vaccines are chosen will determine how logistically of a nightmare that'll be. So, and then Ken already mentioned the CARES Act funding. I do continue to work with finance and our local municipalities on CARES funding to position us well for that as well. So if anybody has any questions, we'll take it. That's my report.
Sue, I have you on the floor.
Thank you. Good morning, everybody. This is Sue Powers, Public Health Manager and Health Officer. First, I better ask, can you hear me okay?
Yes.
Okay, great. Thank you. Big thank you to Dan for organizing the National Guard testing. And I don't know if I should thank him or not, but we had 9 positives from that event last Monday. And of course, that was only 60 people tested. So we'll see within this week what yesterday's testing event brings. And as Dan said, Door County remains classified as a very high level of COVID activity, and this is true across the state. It took the state of Wisconsin 7.5 months to reach 100,000 cases. And then yesterday, just 36 days after reaching that 100,000 milestone, the state reached 200,000 cases. And I bring it up because we really have seen a similar recent surge in Door County. What this data reflects is that we have sustained uncontrolled spread of COVID-19 across the state, including Door County. And I'm just going to, a little reminder, the case numbers we report are just Door County residents, but that may include seasonal residents if they have an address here. Our cumulative case count as of yesterday afternoon was 755. We are getting 10 to 20 plus cases a day. Currently, of that 755, there are 198 active cases. Deaths are up to 6. So what are we seeing? Where are we seeing the spread? It's really has not changed. It's the same as last month. We're hearing about gatherings. They may be large groups, they may be small group, they may be family, they may be friends. Just because you're related does not mean you cannot get COVID from someone. Groups gathering or meeting at bars. Use of alcohol seems in particular to promote behaviors that spread COVID. Weddings, people are still attending large weddings. Household spread is a given. We have really seen minimal amount of spread at our K through 12 schools. So limiting public gatherings remains an important strategy in how we can stop the spread. You've probably seen in the news that emergency order number 3 is again on hold due to a court case. This does not discount the science around spread. We know that, and we have learned that spread occurs most easily with people in prolonged, poorly ventilated, close proximity, particularly when they're protection-free without masks. Another real concern that we're seeing promoting the spread is that people simply do not want to adhere to a 14-day quarantine period. Some of that may be misunderstanding. They feel that after day 5, if they get a negative test, they can go back to work, and that is simply not true. You can test, the science tells us that you can test positive anywhere in that 14-day incubation period after exposure. As far as our follow-ups, we remain extremely busy, but since modifying our contact tracing efforts, as I've described before, we've been able to consistently get to those newly diagnosed within our 24-hour goal. And other local health departments across the region, as well as the state contact tracing team, has adhered to the strategy that we are using. So we contact the newly diagnosed positive case, discuss isolation and what that means, talk about household members, what they should do as far as quarantine. If they happen to be present, we'll certainly talk with them. And then we also discuss criteria for other close contacts with that positive case. What we have not had capacity to do and stop doing for the most part is making the calls to those close contacts. We provide all the information. We may refer them to the state website for information, or we are happy to email them if they share the email with us. And we ask the positive case to notify their close contacts. So as of last week, key public health staff, and I'm going to use key staff several times, so I'll define it. It's the 3 nurses and Chelsea, our registered sanitarian / health educator. Those 4 folks have had a new schedule of rotating weekends and then days off during the week. So this is just week 2 of that, but I'm optimistic this is really going to work out well. Currently, we have 4 LTE, limited term employee contact tracers on board, and we were doing interviews last week as well as this week, hoping to hire several more contact tracers, perhaps 4 to 5, depending on the hours they can work. The funding we have for contact tracing is separate and a different, it's public health funding, different from what Ken just explained about the CARES Act. So key staff is focusing on handling higher level concerns in the businesses and with schools. Key staff are talking with school nurses or other school leadership staff on a daily basis regarding concerns. And then on a weekly basis, we meet with school leadership superintendents. One public health nurse, Katie Van Lannen, worked with Dan and others on the flu vaccine clinics. Really have to thank Dan, as well as our EMS department, Aaron Leclerc, Robin Gordon and their crew, as well as Chris Hecht from the Sister Bay Fire Department and his volunteers. We literally could not have done the drive-through flu vaccine clinics without your help. 880 doses were administered at the drive-through clinics. And I think, as Dan pointed out, not only that, it was really valuable practice of procedures and will help us tremendously in being prepared for dispensing Covaxin when it becomes available. Other things we are doing today at 4:00, we're having another virtual educational presentation for businesses, allowing opportunities for them to ask questions. Meeting link is on the county website under the COVID section if anyone is interested. And, just in summary, I think we're all tired of the pandemic. It seems to not change, but it really is changing right now with the surge in cases. And now is not the time for any of us to be complacent. The pandemic remains 99% of our efforts at public health. And we just need to say once again, please continue physical distancing, masking, and hand washing. And I know we're all tired of hearing that. We're tired of talking about it. That's all I had for my report this morning.
Thank you, Sue. We do have a number of questions. David?
Yeah, my first question is for the administrator. On your page 9 report, we still need to report the air filtration system modifications of county buildings. I am understanding it correctly that they've been done, right? And it's just a matter of we haven't submitted the bills to the...
That is correct.
Okay, good. Thank you. The other question I have is between Sue or Dan. We live in a county where a lot of health events that occur, generally speaking, if they're severe enough, get transferred out of the county simply because, there are other entities that are better suited to handle various aspects of that. When I'm looking at the daily reporting of the various counties, I was surprised at the numbers that Door County of the severe cases not being as high as I would have expected based on our rise in cases. Are those COVID cases that require hospitalization being transferred out of the county, or are we simply not having cases that deem that necessary? It seems like a disconnect with the reporting aspect of it. Maybe they reported at Brown County because they're physically in a hospital there.
So I can start to answer that, and Dan, feel free if you have anything to add. Again, all our numbers have to do with county of residency. It doesn't matter if you're hospitalized in Brown County, it will be reported on the Door County report because you are a Door County resident. And we have had some more severe cases that were hospitalized here. I know last week, really the hospital, Door County Medical Center, was over capacity. I believe last night, Dr. Heiss said they had 31 inpatients last week, and they are a 25-bed capacity hospital. So they, implemented some surge planning, and they had more than 5 COVID patients in their COVID unit, and that is set up for 5. I believe they had 7 at one point. So smaller numbers, smaller amount of hospitalizations.
Laura?
Thanks. Good morning, Sue Powers. Question for you. Back when I was on the committee, Health and Human Services Committee, I recall, and this is many months ago, I think it was in March, February, I recalled that you gave a ratio that for every 1 positive case, there's likely 10 positive cases. And I was just wondering, is that with such the high numbers and such quick contracting or numbers spiking, is that still the same of what the science and the healthcare is saying? Is it still 1 to 10, or is it more like a 1 to 20?
Good question, Laura, and I don't have an exact answer, and I've wondered that myself in the last couple of weeks. What we do know for sure is that COVID is spread much more efficiently than the flu, but not quite as efficiently as measles, which, hangs in the air for several hours. And you can contract it, for 2 hours after someone has left a room. So it's somewhere in between those two parameters.
So do you think is that something that you could request from the state or to see where their ratio is at? That I think that's a very healthy perspective, and I think maybe with the fatigue of the hand washing and social distancing and face masks, I sometimes think that is a good ratio number to give people a reality of how much prevalence is around us, that they might have better behavior.
Yeah. So great minds think alike, Laura. Yesterday, I made a concentrated effort to try to research that on the state and CDC websites, and I didn't come up with anything.
Keep us posted.
Yeah, thanks.
Cara?
Thank you. I wanted to ask a question, but also just to say how much I appreciate Sue's speaking about science. And I was wondering about if there was anything that we could collectively do, stronger like leadership ways, if there was anything that, Sue, you thought that we could do as a county board to assist more, like to put more power behind what you're doing in your department.
Thank you. Really appreciate that idea. And honestly, I can't think of anything that the county board could do as a group. I really, truly believe that at present, the power is going to come from a grassroots individual level. And I just want to encourage everybody to model safe behavior and, do things like stay home as much as possible and limit interactions. I didn't mention Halloween is coming up, and we have put out some Halloween safety guidance. So, just if you can adhere and model those safe behaviors, it's really a help. People, to some extent, are tired of hearing from us. And I think word of mouth on a grassroots level is more powerful right now.
Thank you.
Todd? Yeah, just a quick question. As it relates to the new KPI that Dan talked about when he talked about persons versus tests, is that just purely to account for people that have multiple tests and to clear that up, or is there more behind that measurement? Then I've got a follow-up.
Yeah, as I understand it, it's just to clarify the difference between people who are tested maybe multiple times a week or multiple weeks in a month, that kind of thing, just to clear those numbers up because they were seeing a lot of duplication in their numbers.
Thank you. And then do you have a sense of what the turnaround time has been for the testing that is being done through the county? Is that a 24, 36, 48, or?
Sue can talk more about DCMC turnaround times. I know with the Wisconsin National Guard, they're looking right now around 3 to 5 days, 3 aggressively 5 would be the far end of that. I know that there are some limited amounts of tests that the hospital has available to them for such as surgical procedures that do have a 24-hour or less turnaround time on those.
Yeah, I was talking more specifically about the ones through the National Guard. Are those locally or sent out, and are they consistent?
Yeah, those are sent out. And last week we got them results from the Monday testing. I want to say in 3 to 4 days. It was certainly before Friday. So they came. We thought it was pretty quick for the National Guard.
Thank you.
Susan?
I'm aware that the hospital has done some testing, or the clinic has done some antigen testing. And I'm wondering if Sue could or Dan could comment on what's being done with that and how that's being used, how that information is used.
Sure, I would be happy to comment on that, Susie. And although I'm groaning inside because antigen versus other testing is kind of complicated and difficult for all of us to understand and appreciate. So antigen testing is more readily available kind of testing and has been used by Aurora Clinic here for a while. The hospital is going to begin using it, I believe, as of tomorrow, last I heard. The parameters, so PCR testing, which is the usual test, is diagnostic and is regarded as the gold standard, and the state considers that definite confirmatory testing. If you test positive with a PCR, you are regarded as a confirmed case. Not so with antigen testing. So it is recommended and is most reliable for when people have symptoms. And I believe unless this has changed, it's within, the first 5 days of symptom onset that is most reliable. It is also used at times in outbreak situations. So that would involve testing some people that are not symptomatic, but it is less reliable there. It is not regarded by the state as confirmatory. So if you test positive with an antigen test, your healthcare provider will tell you are positive. When we follow up, we will follow up in the same manner we do as if you had a PCR test. But you are regarded on the state system and in our case count as a probable case. And you may have noticed yesterday we started adding that probable case parameter to our situation report simply because Door County Medical Center will be using that. They have told me that they are going to be very mindful of how they use that test, and it won't be on a routine basis.
Sue, this is Dave. Could you just clarify? There's some confusion in communication. An antigen test is not the same as an antibody test.
Oh, right. Yeah. Antibody test is the blood test, and that tells you whether you've had a past infection of COVID-19. Antigen testing is a swab similar to the PCR swabbing.
Thank you.
I have one more. I'm wondering what you're seeing or hearing about the things that we've heard about, that even people who are asymptomatic that have it sometimes have underlying damage that happens as a result of it that goes on, I suppose, for the rest of their lives. I don't know. I wonder if that's the path you've seen that pattern in our cases in our county.
Yeah, frankly, Susie, I don't know a lot about that because we follow up with folks at the onset and, early on in their illness. Haven't heard about later so much.
Thank you.
Laura.
Yeah, thanks. Hi, Sue again. So the rapid testing, the 1 hour results for rapid testing, and perhaps you have already answered this because the PCR is state, but in the next several weeks, who knows, maybe this rapid testing has a gold star 2 standard. Do you see this type of machine as something that the county or public health, the county or county board here, we could authorize some type of purchase of that nature, so then that could help keep our public schools open or get their public schools open? So if there's positive cases, people can get tested and then have a quick turnaround of that 1 hour and get back to school. What do you think with that?
So I'm going to just point out, Laura, that public health is not a healthcare provider. And also, Door County Medical Center has really prioritized testing for school staff and students and try to use that rapid test whenever it's available. They've had at least one occurrence where the testing machine was down for a period of time, so that happens. It's not alarming. It's a piece of machinery that, can have difficulties like other pieces of machinery. But they do, do a really nice job of prioritizing those cases for the very reason you pointed out, to keep our schools safe and open as much as possible. If we had a testing machine, we would need procedures and we would need staff for that. And that would pose some challenges. Not to say it couldn't be done. I am hopeful that, the National Guard routine testing is going to help with some capacity issues, and Door County Medical Center is always looking at ramping up their efforts, which, they have been.
Thank you.
Thank you. Are you able to hear me?
Yes.
Thank you. Thank you, Sue. The question that I keep getting from people, and I'm trying to figure out myself, is, and maybe there's not a perfect answer, but when to be tested. If you had a contact, and this kind of goes to Laura's point about a rapid test response, do you get tested on day 1 after the contact, or day 14, or somewhere in between? Because if you can't be confident of a result being true until the 14th day, I'm trying to figure out how to know when you're truly negative or positive.
Good, very good questions. So some people, well, first of all, the short answer is if you've been exposed and you become symptomatic, that's when you should get tested. You shouldn't get tested before day 5, simply because the test may not, the viral load in your system may not have replicated enough to show up on the test. But having said that, it may take till day 14 for that to occur. So if you are asymptomatic and during your 14-day quarantine, you want to be tested, we recommend after day 5. And, I guess personally, I would go about day 10 because it may take 3 or so days for a result. And then if it's negative, then by day 14, I'm doubly sure, if I'm still asymptomatic, that I'm negative. Having said that, you can certainly show no symptoms and test positive. And if that occurs, then you need to isolate for 10 days or continue the 14-day quarantine, whichever time period is longer.
David.
Thank you. Sue, many people I cross paths with will compare this to the flu, saying that's no different than the flu. I'm not going to worry about it. I'm not concerned about getting sick. If I do, I'll be done with it in the next amount of days. One of the differences I don't hear people speaking about, we've been asked the question here, but I'm going to ask you, is we're starting to see news reports already of complications of other parts of the human body of people that have had it. That we've seen lung issues, we've seen heart issues that they are believing are tied to having had COVID-19. Can you speak on any of the more current data that is existing? I haven't seen anything in a couple of weeks. And one thing that doesn't get reported on the news is they speak about people starting to show these symptoms of issues, pre-existing conditions due to the COVID-19. But they don't say if they're people that were only hospitalized to that scale, or people that simply had a bad version of it, but not bad enough to be hospitalized, are also showing complications. If you have any information on either of those two topics, that would be appreciated.
Well, there are, as you pointed out, there are a lot of unknowns with COVID, and that distinctly makes it different from influenza. Influenza's been around for a long time. We've studied it. It's more predictable. There are some treatments for it. Right now, there's just still treatments for COVID that are being either experimental or accepted as there is an antiviral drug, but its effectiveness is, not the greatest from what I've heard. As far as who what type of person and how long or what type of long-term complications people are getting. I don't have any specific data on that, and we are certainly learning all the time about that.
Thank you.
Thank you, Sue. Thank you, Dan. We are going to take a 10-minute recess and reconvene at 20 to 11.